everyone, welcome to your lesson on growth and development for the preschooler. Just like the lesson that we did on growth and development for toddlers and infants, what we're going to do is look at the milestones that you need to be aware of and then talk about how all of this affects your nursing interactions with them. I have to say I really love this age group. There are a lot of sort of unique developmental things that are happening. So let's get started. So preschoolers are 3 to 5 years old, and in these 3 years, they really transition from being chubby, baby-like little kids who still need a lot of help with pretty much everything to being more slim, very agile children who can very nearly get themselves ready for school in the morning all on their own. And at the same time, they're also becoming a lot more social. They still are just like a little bit egocentric, but they are starting to be able to look outside of themselves a little bit. So it's pretty exciting. So let's get started looking at the milestones, and we'll start with their growth. Okay, so a really major thing that happens in our preschoolers about growth is that really everything is a lot more stable. Infants and toddlers, everything's happening really rapidly in terms of growth. So there's some risk there. But for our preschoolers, it's kind of just slowed down a bit. They typically gain about 5 pounds per year, and they may grow 2 to 3 inches per year. And rather than seeing that trunk get longer, the growth sort of starts to come from the legs here as they get, again, longer and a bit more slim. For motor development, preschoolers are really just becoming so much more graceful. We see a lot fewer falls and episodes of toppling over here. Their coordination and those hand-eye movements are just improving by leaps and bounds. And so for gross motor things, what we're looking for is that by 3, the child's going to be able to ride a tricycle. And then in 2 years, they're able to ride a bike, probably without training wheels. So again, a lot of things happening. A 4-year-old should be able to hop on 1 foot, and you start to see them do things like jumping rope and some of those fun schoolyard activities that we are so familiar with. For fine motor skills, we expect a 3 to 4-year-old to be able to copy a square, and a 5-year-old should be able to do a slightly more complicated shape like copying a triangle. One thing to note is that a 3-year-old, if you ask them to draw a person, you're going to get something that kind of looks like a sun. Where this changes quite a bit, by the time they're 5, they should be able to draw a person that looks more like a standard stick figure. Okay, moving on to language development. Language for preschoolers is pretty impressive. Their knowledge is pretty comprehensive. They're hilarious. They can spin stories out of nothing and come up with just the craziest ideas. Sometimes this can make getting a good understanding of what's happening or what hurts a little bit difficult. But if you try really hard to ask them direct questions, they can usually give you some actually pretty helpful information about how they're feeling. One red flag to note here is that by age 3, their speech should be pretty clear. It's common for toddlers to have their own sort of cute little baby talk that only their parents understand, but by those preschool years, this should change, and people who don't already know the child should be able to understand them. Preschoolers are in the initiative versus guilt phase when it comes to their psychosocial development. They are so eager to try new things, and they're very proud of themselves when they accomplish them. Equally, they can get pretty upset and feel guilty when they don't. So a lot of what's actually happening during these years is that they are doing all these tasks and trying all these things, and it's preparing them to attend school. And one of the shifts that we're looking for around 3 years is a change in their play. Before this, they're more comfortable sort of playing independently, but preschoolers, they really start to enjoy playing with other people their own age. We call this cooperative play. And that means that they're involving other kids, and they're communicating and saying, you do this, and then you try this, and that's very interactive. And if a child doesn't display an interest in cooperative play and seems to prefer always being alone, this is considered a red flag for social development. All right, moving on to think a little bit about the cognitive development of a preschooler. There are 3 things that can actually make caring for them just a little bit more difficult. And these things are, they have magical thinking, they have a poor concept of time, and they have a really intense fear of injury and sort of bodily harm. With magical thinking, the preschooler may actually think that their illness is a punishment for something they thought or something they did. So it's very, very important to reassure them that what's happening is not a punishment. When it comes to their concept of time, you have to be really careful about causing anxiety in the hospital by preparing them for a procedure too far in advance. Ideally, you just need to tell them very shortly or immediately before the procedure. And this is also true for toddlers. When it comes to their fear of injury, they are very worried about things like having holes in their body. So always come prepared with a bandage or a Band-Aid to help them feel more secure. So now that we've gone over milestones, let's move to talk about safety and patient education. I think you can tell that the preschool years are actually a lot more stable developmentally. And the same is also true for your school-age kids. There is still a lot going on, but the risks are decreasing. So there isn't actually quite as much to talk about in terms of prevention. Most of the problems that come up are just common illnesses or they're injury related. So for this age group, most of the education is still around that common theme of injury prevention. One thing that we do add to the picture now, though, because they're preparing for school and the kid has a slightly wider social experience, now we're looking to educate that child and the parent on topics like traffic safety and road safety, sexual abuse prevention, dental health, and other really important self-care topics. If you take a look at the outline that goes along with this lesson, there are a lot more details on these different topics. Okay, your priority nursing concepts for the content that we've just covered about preschool growth and development are human development, patient-centered care, and health promotion. Okay, that wraps up our chat about kids ages 3 to 5. Your key learning points for this age group are, number 1, remember that the driving force is their energy and enthusiasm for trying new things. So they're constantly taking the initiative to master new skills. Number 2, their social experiences are totally expanding. Remember, we want to see them transition from preferring to playing by themselves to a preference for playing with other kids. Number 3, their unique way of thinking means that we have to be extra careful about what we say, how we say it, and when we say it. And lastly, number 4, their development at this age, it has the end goal of getting them ready to go to school. Parents may be worried about this, and so a lot of our education will tend to be aimed towards supporting them all through this transition. All right, that's it for our lesson on growth and development during the preschool years. Remember, preschoolers are really fun and they have a unique way of thinking that can bring a lot to the nursing experience. So make sure you check out all of the resources that we have attached to this lesson. Now go out and be your best self today, and happy nursing.